Yeah. Go to King's, because I said so. It's Wednesday, and they've got this great local lunch special. In fact, a different meal every day, right? Monday through Friday. And it's Wednesday, so we're doing pork sinigang. Oh wow, and they do it. They do it well. They bring in like 2 or 3 yayas, and they have they have them make the pork sinigang right there from scratch. That's how good it is. Find it for lunch today at King's.
Family Finance has been serving the people of Guam since 1959, and they'll continue to be there for you in the years to come. Whether you're looking to get a personal loan for that summer vacation or paying off those long overdue bills, Family Finance has got you covered. Apply for a personal loan from $1,000 up to $3,500 by calling Family Finance in Hagåtña at 475-4545, Upper Tuon 647-5626, or in Dedito 633-4473. Family Finance has been serving the people of Guam since 1959.
Portions of the program also brought to you by APL. That's American President Lines. APL is shipping the future.
I want my baby back, baby back, baby back, baby back.
Chili's Rib Fest is back. You can get saucy with their fall off the bone, slow smoked half rack of ribs for $10.99. Available in original, roasted garlic, or honey chipotle flavors. Served with home style fries. Add an additional half rack of ribs for just $7. Low and slow is the key to more flavor. Chili's Rib Fest for $10.99. Available for a limited time. Chili's, more life happens here.
Baby back, baby back, baby back, baby back.
Ray Gibson brings you closer to the action. Watch and listen live on thepoint.gu.
It's the Ray Gibson Show at 7 after 9 here on The Point. That's 93.3, and generally got the soundproof studios, but there is some noise that I think only the guests are going to be able to hear outside, and that is with a little bit of inside baseball. We have a huge piece of transmission equipment that is being delivered to the areas that you guys were just sitting at a few minutes ago, and so there's a little bit of a racket that's being made there. If anybody screams, I've got at least 2 MDs in the building, right? I've got it. Okay, that's wonderful. And so let me just kind of go around the corner here and introduce everybody. And I'll start with the guy that doesn't necessarily have a camera in front of him. He is the Chief Medical Officer for Guam Regional Medical City, Dr. Felix Cabrera. Good morning.
Good morning, Ray. Thanks for having us.
No, it's great to have you guys. You know, I always feel like a plank owner of the Guam Regional Medical City, because it was years and years ago that Pete Scrow and I and a bunch of other folks in the community got together and kind of laid out a vision for what we wanted to see in a new private hospital on Guam. And then the good news is that we started actually building one of these things, got with the Bengzon family, and before you knew it, there was groundbreaking, and there was time capsule insertion into the ground, and then there was a hospital there.
Yeah, and you were there on our opening day.
I was there for every single part of it.
And you were broadcasting live from the lobby.
From the lobby. I did the live broadcast from there as we did the ribbon cutting and everything for the hospital. So as I say, I always feel like a plank owner of the place, and it's interesting to watch its development over the years and all of the new things that are coming along, and different specialties that the hospital brings in. Also in the studio, Rose Grino, my daughter's classmate's mom, is here, but she's also the specialty clinic administrator at GRMC. Give me a little bit of background on that title.
Ray, but before that, you just make me remember that on the very first meeting with Pete Scrow, we were there at Hilton.
Yes.
When we trained all of this, the foundation together, when he tried to ask for, the healthcare leaders. We were there, and that's very first meeting.
Because it was important, I think, for Peter to get a number of different viewpoints from people in the community on what a new private hospital would mean. And it's so interesting now. If you think about the original mind mapping that we were doing there, it almost mirrored completely the product that we ended up with GRMC.
Yeah.
The differences in the technology and the different kinds of medical treatments that are available at GRMC. Some of them sometimes will run parallel with what happens at Guam Memorial Hospital and other clinics. And then in other cases, we've got some new specialties and different things that GRMC doctors are able to bring to the community, independent of anything else that goes on.
And now here am I, that I'm the clinic administrator of the outpatient specialty clinic on the GRMC. So pretty much manage that whole outpatient clinic.
Which is, it's a different way to look at a hospital. A lot of times you think in a hospital, it's an emergency room, it's someplace where you go for surgery, it's someplace where you go if you're going to be there for a while. But there, as you point out, are a lot of outpatient services.
Yes, yeah. So we do have, it's really a full complement outpatient clinic, specialty clinic. We have to really emphasize that. So we have the oncology clinic, where you do infusion, and we have our oncologists, and then we have the cardiopulmonary clinic where we have the cardiologist, our pulmonologist is there. It's really exciting. We have a full complement of that. And then we go back to the other side. We have the specialty clinic that composed of course, Dr. Tutnauer are here, and then our ortho. We have orthopedics. We have a general surgery, and also infectious disease. And another exciting clinic is we have a neuro clinic. So we have a neurologist and a neurosurgeon.
Kind of all under one roof. And so if you've got these issues and you don't know where to go, it might be worthwhile stopping by GRMC and just, not via the emergency room. We prefer to see you, set up an appointment with somebody and say, I've got this issue. Is there something that you can do? And let them guide you through the process. Because I know with neuro, a lot of people are thinking it's only in the brain. But with neuro, it's all the way down the spine. And there are so many people that you might be afflicted with something. You might be going to one kind of a doctor or another where really the problem is not there. It's not in the muscles of the back. It's actually in the nerves that are connected, the connective tissue all the way up to the brain. So go and always get that's where I'd go for the first opinion, frankly. But and in the studio, you didn't mention the hyperbaric.
We do all have wound care and hyperbarics.
There we go.
Thank you so much.
You're welcome.
Because I know you have that.
Well, that's my ante is there, right? So it's Auntie what? There's I always forget her first name.
Edna. Yes.
Auntie Edna is the one that runs that.
Of course.
We have to bring her back in because she was a fun interview. So what we're basically doing here is a continuation of something that I did when I was at K57. We always had somebody from GRMC come in. I don't know, like once every couple of weeks or something like that. Whenever there was a new doctor coming in that frankly they knew I would have a good time interviewing. And because you guys are all thinking, this is marketing, this is publicity. No, this is entertainment for me. So I hope you pick up on that. And so let me put my glasses on, make sure I'm reading names correctly. Dr. Phillip Tutnauer.
Yes, sir.
Yes, sir. That's you, right?
Half a day. Yes, sir.
Half a day.
See?
Yes, it's good to have you in the studio. And so we'll start first with you're from New Jersey. Can you say coffee?
Coffee.
It's exactly the way I knew it was going to come out that way. So there's some climate differences between here and New Jersey at certain times of the year. How are you adjusting to the brutal tropical heat?
Thank God for air conditioning.
They get that. So you got the air conditioned office at the GRMC.
Yes, sir.
Good for you. Good for you. But you've also done other work. It's not just in your practice in New Jersey. You've also been around the world doing I want to say mission work and working with the Indians out in the desert.
Yes, for the Navajo Nation in Chinle, Arizona, which is the Four Corners region of the United States, and treating some pretty severe diabetics with all kinds of foot problems and ulcers. And I found that Guam, we have many people with very similar issues as the Native American population has.
There's something about the westernized diet and the westernized way of life here that because you see it all over the Pacific as well. You get people that had lived off the land and off the sea for as many years as they did, and all of a sudden we don't have to raise the cow. I can go to the store and buy the meat, and I don't have to do anything else. So you get that a lot of processed food in the diet, and unfortunately unchecked without a good diet and exercise program that will often lead to diabetes, and the symptoms and the follow-on maladies that come just from that initial diagnosis are reasons why people will need to see you. We need to preserve the toes, keep the feet, and keep the legs, because after that you're a goner, right?
Well, I mean, thank God with the advent of a multidisciplinary multi-specialty team, which we have in place at GRMC, we're able to provide for all the services that a patient who may have just a toe infection, we can have all the services provided for them with, I must say, the most up-to-date equipment that's available at any large university that we have on the mainland.
Well, let's go with that here for a second, because as you can tell by looking around here at the technology that we have in the building here, I'm a real technophile. So tell me about what you have at your disposal. What kind of gee whiz software and hardware do you have that might help prevent amputations?
So what we have is a full complement of radiological services, such as an MRI machine. We have ultrasound units. We have CAT scan machines. We have regular X-ray machinery. So we are able to provide.
Still keeping the X-rays around, huh? Old time's sake.
It's still a great modality. It still helps us greatly when we're looking at, for example, bunions, hammer toes. You know, we're looking.
Stop. What is hammer toes?
So a hammer toe is a.
Do we have pictures, Felix? Did you bring it? Do you think you might have something on the phone? Because I hear that, and usually it's a kind of a derogatory thing. Did you?
No,
Yeah,
it's
she's
not.
pretty in the face, but she got hammer toes.
So a hammer toe is actually a curved toe, basically, and it can be very painful in certain shoe gear. You can
I'll try to
develop,
feel bad about making jokes.
and you can have corns because of a hammer toe. You can have calluses on the bottom of the foot because of a misshapen toe, and for the most part, it's hereditary. And
Put that up
you'll see-
in the camera so everybody can see it on the Facebook Live. Otherwise, go to your Google and Google hammer toes, and you'll see exactly the condition. Is it preventable?
For the most part, with the proper shoe gear, with a custom-made arch support, we can help slow down the process. But again, for the most part, they're hereditary, and we're talking about genetics.
Yeah, so if your mother had it, you will probably have it. If your father had it, you will probably have it. Is it predominantly a woman's or a man's issue?
No, it's not. I mean, I think more women come in for treatment because of their shoe gear.
Because they have to wear open toes, and people will see, and they want to be
High
able to.
heels.
Yeah, look, there's a big gala coming up. Is it something that you can take care of rather quickly, or is it a long process to? I don't want to use straightening out the feet. I guess does it take a while?
So there are several things that we can do which are non-invasive in terms of padding, proper shoe gear recommendations, proper fitting of shoes. I mean, not every shoe manufacturer, a size 8 is a size 8.
That's a complete and total mystery to me.
Yeah, so
is getting the right shoe size, and I'm one of those guys where one foot is actually about a half a size bigger than the other, but I can never remember which one. And what they won't let you do at the shoe stores, I don't know if you've tried this, I know I have, is I will take a 9.5 and a 10, and I'll take the 9.5 out of the box, and then I'll take the 10 out of the box, and then take that to the cashier. They don't let you do that. Did you know they check? I know because I tried that at every shoe store on Guam, and every single one will check and make sure that the shoes are the same size. But my feet need to have shoes that are different sizes. So how do I take care of that? How do I equalize between the 9.5 and the 10?
So the most common thing to do is to get evaluated by a podiatrist as far as your feet go.
Did you bring anything with you?
And we have
Did you bring the little shoehorn thing like at Tom McCann?
the Braddock devices, so we have that available for measuring feet. Again, that's just a guide. As far as with 2 feet that are being one size larger than the other, you have to go for the size that's larger, and then you can
Obviously.
put inserts in the shoe that's a little too wide or
But it
too
feels
large.
funny.
And it may feel a little, but it's something you get used to.
Yeah, I guess. I'm desperate to ask questions about running injuries because I'm a marathon guy. But I need to take care of certain among my brethren, and I'm sure Felix and Rose, you've got people like this in your life that have to take a pill before the meal, or they will suffer in great pain over several days because of an attack of gout that has been triggered by something that they've eaten at a fiesta, a party, a fandango, a fanakput, or whatever. And so the question that I've got for you, I don't know if there's a cure for it, but what's the conventional wisdom on treatment of gout or prevention of the gout attacks?
So gout is caused by uric acid crystals that end up getting into a joint. It's actually
How does it do that?
So
My bladder's way up here and the feet's way down there.
Trust
I
me, it
checked the
gets
map.
there. It's very interesting of how that all happens.
Mm-hmm.
And one of the other services that we will be providing at GRMC is a rheumatologist coming aboard. And a lot of times it's a rheumatological type of problem. So in any case, the uric acid, you have to watch your diet very carefully.
Oh, yeah, of course.
Too much red meat, too much shellfish or seafood, you have to be careful. Everything within moderation, as they say.
Do you know where you are? Because everything you just described is, I mean, that's the first 5 things in a fiesta table.
So again, in moderation.
Yeah. So even a little bit, though. I mean, I know some guys, it's just like they get a whiff of it, and all of a sudden their feet hurt, and you can't, to hear these guys talk about it, you can't lay down and put a sheet on your feet because it will just trigger some more pain. So I mean, obviously there's pain management that goes along with some of this, but you had linked it to rheumatic diseases. What's the connection between gout and rheumatoid disease?
So what happens is gout can actually cause a destruction of the joint, and it has a specific type of appearance, especially when you take an x-ray of it. So the connection is just as anything else in the body, that it just forms, it just happens. Some people are more susceptible than others, and we're still looking into the whys of it. But again, it's something that you should speak with your internal medicine or family practice doctor, because there may be something within your system that needs to be evaluated. The treatments basically can consist of non-steroidal anti-inflammatory medications. Sometimes if you have chronic
3
gout,
Tylenols then.
well, I wouldn't, go that far. There are other medications as far as trying to keep the uric acid levels down. There are, medications in terms of trying to certainly keep the pain away, but
There's a
lifestyle.
pill. I know. I forget the name of it. I think my brother's got some, but I know a bunch of other friends have some. So when they know, I think without breaking too many HIPAA laws, I know guys. They know when they go to the Philippines that they're going to be having some crispy patas, right? And so for them, pork is the trigger, and they take a pill prior to eating it, and that's supposed to help mitigate some of the factors. Are you familiar with that?
It should be colchicine.
Colchicine or indocin.
Probably colchicine.
Can you buy that at the store? Or is that
with a
prescription only?
prescription.
With a prescription, okay. All right. But not in Manila, you can buy anything without a prescription.
Essentially.
Yeah.
But just to kind of clarify what a rheumatologist is, so when we think about our body, we have our defenses against outside threats, basically. But a lot of times there's friendly fire within our body.
Okay.
So our body attacks ourselves in other ways. So this can be lupus, it could be rheumatic arthritis, it could be gout.
Fibromyalgia fall into that category?
Fibromyalgia is a subspectrum of that.
Are you starting to see, just as an aside, are you starting to see more of that? Because my mother suffered from it, and when I mention that to people, they go, oh, you know what, I know so-and-so has it, I know so-and-so has it. It seems to be one of these things that's on the rise.
Yeah, and it's just a more recognized, a more diagnosed condition. I think that's the most part. Not that the incidence has necessarily gone up, it's just the recognition of it.
We see it easier now.
Yeah, and so when you think about uric acid, when it crystallizes, turns into almost tiny crystals in a joint, your body sees that as a foreign object. That shouldn't be there. And then it starts attacking, and then that's the flare-up.
Right.
Yeah.
Then that's the inflammation. That's the thing that we eventually have to control, and a little bit of pain management
the
here.
foot being the further down, it's more likely to get caught up and be more active down there. That's why the feet are more common.
And there is a truth to the idea that there are a lot of nerves in the feet. So if something happens down there, you're going to feel it.
Yeah, absolutely. It's, the nerve endings for the whole spinal cord actually end up in the foot. And that actually is an interesting point.
Anybody stepped on a Lego knows what I'm talking about. Anybody that ever stubbed their toe at 3 o'clock in the morning looking for the flashlight when the power's out knows exactly what I'm talking about. It seems like an inordinate amount of pain given the surface area that has been nicked. You know what I mean?
Especially for the pinky toe, which ends up with what we would call a bedpost fracture.
Oh yeah. Well, I know people just want to get it amputated. Just take it off because I'm not using it, and as far as I'm concerned, it's just a magnet for pain.
Absolutely. And I just saw a patient that stepped on a piece of coral, and actually I had to debride it, and actually they healed up fine. They ended up having an infection because of a piece of coral that was in their foot, and I was able to fix that for them. Basically, within a couple of days, they were fine. And this was a very bad diabetic who really needed that care. And it could have led to something that could have been much more of a severe situation, but because that individual came in and got evaluated by me and our team,
We will solve
able
that
to
problem.
avert.
At least one less concern for his feet.
Absolutely,
Which is
yes.
always good news. One of the other places, and I have vivid memories. I was 13 years old, and I don't know what it was, maybe a nervous tick or something like that. But I had pulled out the edge of my great toenail. And it subsequently became infected. And then they took me to a doctor that took the actual toenail out. And it never grew back right. It looks like it's got some weird kind of fungus on it. And I used it to scare my kids into submission back in the day. but and so that's not the thing. But I mean, do you see a lot of those infections caused by just some kind of wacky cut on the or way to cut the toenail?
So certainly ingrown toenails and fungus toenails are one of the most common conditions that a podiatrist will evaluate and treat. And some of these things are office-based procedures that can be done same day. So if you were to come in, we would be able to address it and deal with it and get you on the road to recovery within a few hours.
So with the fungus one, like I said, it doesn't grow back. In fact, it has a strange kind of part of it, it's all lined up and everything, and it's kind of gross, and then it splits and becomes almost two toenails in there. Is that a fungus?
So many times a fungus toenail will be thick, yellow, and discolored.
Yeah.
And it could be yellow, it could be brown, and again, go into your
I'm going
primary
to take my
care.
shoes off and show him. Sorry, that's not why they brought him in here, Ray. It's not a drive-by diagnosis. I'll take a picture and send it to you.
No problem, anytime.
Because, like I said, it's one of those things. I'm a little embarrassed sometimes to wear Zoris, but now I'm reading up on some of the Q&A here, and I guess Zoris aren't good for me.
Well, the best type of shoe gear is whatever you feel comfortable in with the proper sizing. Certainly breathable materials is important. And, again, I would recommend getting evaluated by your primary care doc and having them give you a referral to a podiatrist to evaluate your feet, because arch support is very important, and making sure that your foot is not compensating for the shoe, but that the shoe is compensating for your foot type.
Yeah, but it's hard to tell that over the years, isn't it? As you buy the same style shoes, or you've got a certain walking pattern, and you kind of bend the shoe to your will. Sometimes it's the opposite. As a runner, I will tell you that I have bought expensive shoes only to put them in the closet because I don't like the way that they were trying to make my feet approach the pavement.
And that's why I'm recommending custom fabricated orthotics, which can help to prevent your foot from doing abnormal motions, or what's called pronation.
Or supination.
Or
yeah.
supination.
Yeah.
So certainly with a custom-made arch support, we're able to avoid some of the discomfort that you may be feeling from the shoe.
But it's hard to run with custom orthotics.
If you have the right type of orthotic.
Yeah. Are they making them softer now?
They have different materials, and we would evaluate your foot, and then we can certainly talk about what your activity level is, and then we can make you a device specific for you, which makes it really customized with the materials.
Interesting.
And again, if it's custom made, meaning what we do is we take an impression of your foot.
Right.
We do a gait analysis as well.
Why can't you do an impression of somebody who runs fast and then put that in my feet so I can run faster?
So with a gait analysis unit, we're able to get you to walk, and we're able to evaluate how your feet are positioned when you're actually walking, and make a device based upon your positioning of your foot. when
So
you're
you
walking.
do the impression here and then send it off to a factory, and they will use that as a mold and then come back with the orthotic for you.
That's correct. And what we do is a computerized gait analysis.
How does what does the computer do? How does it do the analysis? Because I've been told that I walk funny because I'm flat-footed.
So many times what we do is we have a computerized mat, and it sends signals to a computer, and it tells you how much time you're in a specific area on a certain area of your foot, because there are several, when you walk, it's the stance phase of gait, as well as the swing phase of gait when your foot is not on the ground. And your foot has to be able to absorb the shock of stepping on it, and then it has to be rigid to push you off to the next step. So you have to, take that all into account. And certainly with the computerized, it's a great tool for us to utilize to evaluate that information, because just by watching you walk, and a good exam, a good podiatric foot exam, we want to see your foot in its naked condition.
Yeah.
So barefoot, basically. And we would have you walk. And we can see by the way you walk, and we look at shoulder drop. If you have a shoulder that maybe dropped down when you're walking, we could look at your hips and see where they're aligned, or your knees, because it may not just be a foot-related issue. It could be an issue with your knee, and it could be an issue with your hip. And we're lucky to have a Dr. Galang, who's our orthopedic surgeon at GRMC, who's able to assist, and we work, together when we deal with patients.
Yeah, because I wanted to ask that question. Where does, podiatry starts in one place and then the orthopedics goes into another direction? It's kind of fuzzy in my head why you can't do both of them. Or are there places where there's overlap in the specialty?
So there's certainly overlap. But again, at GRMC, we work as a team. And we're able to, we're in the same hallway. We're right next to one another. So he can call me, say, Phil, I want you to take a look at this. Or I'm Dr. Glong, can you take a look at this with me? And we work very well together.
Compliment.
Yeah.
I hope you're enjoying the conversation. I know I am. We do have to take a quick break. It's 9:31 in the morning. We'll call that iConnect time, where iConnect wants you to connect longer for less with their incredible push-to-talk and mobile plans.
With the largest inventory of rental equipment on Guam, East West Rental Center is sure to have the tool you need to get your job finished quickly. From equipment rental, party rental, parts and service to used equipment, East West Rental Center has what you need. Call East West Rental Center at 646-1463 or visit them online and browse through their online rental catalog at eastwestrental.com. They're located in Upper Tumon, right across St. John's School. East West Rental Center, providing the island of Guam with quality equipment rentals since 1972.
Do you like avocados? Are actually good for your feet. A home remedy from a long time ago. You take the avocado. If you got foot pain or something, you take the avocado, you smear it all over your feet, and then have somebody lick it off. The things. I'm sorry. Just the things that pop into my head. One day, yes. One day, I'll. what's the matter? Joe's making a face like he's gonna hurl. Well, so don't do the avocado salad commercial then. Avocado is in it. Wendy's, try the new Southwest Avocado Spicy Chicken Sandwich. Guess what makes it spicy? They've got the spicy chicken, then they put some pepper jack cheese in it, Southwest Ranch, Applewood smoked bacon, because it's Wendy's and we bacon everything. Finish it off with cool, creamy avocado. Try the Southwest Avocado Chicken Salad as well. It's at the nearest Wendy's. Now that's better.
The Extra Point with Jerry Roberts of Guam Training every morning on The Ray Gibson Show.
You're looking to fill a premium position. You've got some good candidates coming in to interview for the job. I'm Jerry Roberts, and at 7:20 a.m. on The Ray Gibson Show, we'll be looking to see if you're up to the task.
You can find daily transcripts of The Extra Point by Jerry Roberts at guamtraining.com. Tune in every weekday morning at 7:20 for The Extra Point with Jerry Roberts on The Ray Gibson Show on 93.3 The Point.
Eliason on Facebook Live says, had a lumbar laminectomy there at GRMC a few weeks ago with Dr. Powell. Nerve pain relief at last after 40 years of enduring. Thanks for sharing that, Albert. I appreciate it. Here's the thing that I am learning at 56 years old now. I have for about, last 8 or 9 years, I've got a calcium buildup, a bone buildup on my forehead, which is a common place to get them. And I thought it was just something I was going to have to live with. I thought, we can take it off, but opening up your head and shaving it down, complex procedure, you're going to need to be in the hospital for 2 weeks, and the recovery is going to be painful and all of that. And the thing that I'm finding out here is I probably should have seen a doctor the second that they opened up, because it's about a 20-minute outpatient procedure, right?
Well, it's technically a cosmetic procedure, so it'd be, depends on how important it is to you. If you love to wear hats and you can't wear a hat because of that,
totally vain. I am totally vain. So this is, and I recently, I don't know what stopped me before. I try not to diagnose by Google, but I was looking for something else and found that. And so is that you guys do something like that? You got somebody at the hospital might be able to open it up and shave it down?
We will probably.
What are you doing later, Felix?
Oh, I think I got some time.
We'll go that.
Yeah, because I'm told now, and so that's kind of a point that I want to get to is don't live in pain, for heaven's sakes. Don't, if you've got something wrong with your feet and it hurts to wear shoes or it hurts to wear Zoris, there's things that you want to be able to do. Maybe you're ashamed to do them. Maybe you don't want to wear a certain kind of shoe because of the way your feet look. These are things that we might be able to correct for you.
And Ray, what I want to say is sometimes there are people that are especially diabetics who have a condition called peripheral diabetic neuropathy who may not feel their feet. They may not feel, they feel like they're walking on wood, believe it or not. Or they don't feel anything on their feet. And
Pain can be our friend sometimes.
Yeah.
It tells us when something's wrong, and in their case, they don't get that signal.
So they won't be able to feel the pain. They won't be able to feel the onset of something that might cause them to lose the foot.
Right. So therefore, that would be a development of potentially an ulcer. And then that ulcer can lead to infection. And then it can lead to a below-knee amputation or an amputation of part of their foot. And that's why at GRMC, what we're doing is we're trying to assess those people that may be at risk and to let them know that they're at risk for developing some kind of problem by checking their feet, checking the pulses of their feet, because diabetes can affect the circulation, not just of their eyes. You always hear, go get your eyes checked at least once a year, if not more.
You're looking for the Arcus?
They're
Among everything,
They're looking for a lot of things with the retina, which supplies circulation for the eye as well. But again, for the foot, we see a tremendous amount of individuals because of diabetes where they have poor circulation to their feet. Certainly smoking is really a big contributor to foot-related problems as it relates to diabetes.
When I was a 30-year, two-pack-a-day man, they would say that, and I was never able to make the connection between smoking and my feet. And it's been many years since it was described to me. And for the benefit of the people that are still smoking, that have not yet kicked a habit, or are looking for an excuse to say, yeah, I hadn't thought about that. Maybe this is the reason why today I'm going to stop smoking, or at least get a cessation kit from somewhere. What's the connection between smoking and your feet?
So what it does is it affects, and it's, by the way, it's not just smoking, it's the usage of any tobacco products. So chewing tobacco can affect the microcirculation.
You're taking all the fun out of it. What's wrong with nicotine? It's benign. It's addictive. But what does nicotine do that's bad? Yeah, well, see, that's my point. So when they came out with vaping and they stuck pure nicotine in, and basically you're freebasing it, right? I'm going, well, what's wrong with that? At least there's no
stuff in it.
There's no tar. There's no carbons. There's no other chemicals that we're aware of. And that,
there is.
That becomes
smoke, basically.
that becomes the problem with vaping is I don't know what else is in there. So I've got to be very careful about all of that. But
so again, it affects the microcirculation, the itty bitty little tiny blood vessels that are in your toes and the skin, and it can certainly affect that. And that's why to get your primary care provider to have you referred to a podiatrist would be very important, and to get evaluated. Again, we can check pulses. We have the machinery available within GRMC that can check the circulation and to see where you stand.
We're talking to a GRMC podiatrist, and I hope I'm saying that right, Phillip Tutnauer, who is in town and wants to help you. It says sports injuries, and there's go back to running here for a second, because it's what I know. I spend a lot of time on my feet, several miles a day, and there's debates between me and my friends of what kind of shoes we should be using for what kind of training runs, etc. I generally win those arguments, but I think I do so at great personal cost, because there was a pair of shoes that I was wearing for some time that caused me to, I want to say, pronate excessively. That, combined with my flat feet, made it, according to at least another doctor I talked to, it actually caused the muscle to tear away from the insertion.
Most commonly, that's referred to as shin splints, which are a big problem within the military, especially.
See, I always thought that I'd be able to just stretch my way out of that, but there was 8 months that I could not run. I could do anything else. I could walk, I could swim, I could bike, do all kinds of other sports that I hate, but I could not run.
So it's interesting, having worked with the Native American population in Arizona, I was in the the center of the code talkers, and many of them have either been here, they've certainly been in Saipan during some of the battles as code talkers, and many of them talked to me about how they had lots of pains in their feet when they were in the military. And we talked about their running, and I said, well, before you were in basic training, did you do a good stretching regimen? So when you speak with professional athletes or high-level athletes, you'll find that they're stretching. They're going to the stadiums 2 hours before the games, getting into the jacuzzis, and they have trainers that are stretching each one of them that, potentially for a half hour to 45 minutes prior to even getting on the basketball court. And certainly us weekend warriors, as I would like to call us, we are just running out there. We're doing 5 minutes of stretching, which is certainly not enough. So you have to kind of wake the muscles up to work most efficiently, and then you have to give them a cool down period. And certainly with the right shoe gear and with the proper arch support, we can minimize a lot of these potential injuries like shin splints, like plantar fasciitis, or heel and arch pain.
That's the bane of another runner's life. I generally don't have a problem with plantar fasciitis, but I do have this thing now in my heel, and I think it's because I'm running on a pair of shoes that I really, really like. They're nice and light, and they're fast, and they're exactly the right color, but there's not a whole lot by way of support, and it's odd because it only happens in one foot. So it might be one of these days I'm going to come and see you and see if I can get a custom orthotic that I can put in a pair of running shoes and still maintain that lightness and the good bend that I get on these shoes, so that I can land and push off more efficiently.
Right, and then many times,
So you can actually make me faster.
We can certainly help facilitate the efficiency of your muscles. And sometimes it may be
I want you to say, yes, Ray, I can make you faster. I can get you on the road. Derek Mindell, got nothing on you. Ryan Matenzo, slowpoke. That's what I want to hear.
No, Ray, you'll be running fast in your category.
In my, oh my God!
I have to remind myself I'm in different category now.
I know what you're saying, but I still want to beat those guys. It's fun. What do we got here? Somebody typing in. Guam Regional Medical City is actually chiming in. To make an appointment to see Dr. Tutnauer, call 645-5500 and ask for the specialty clinics. And Daryl Taggarty saying, my dad has received great care at GRMC over a variety of issues. I'm really, really glad to hear that you've got that. And the other thing is, don't forget you've got a connection between GRMC and Medical City in Manila. And there are times where you might be able to get a secondary referral if there's something for whatever reason that you would be more comfortable somebody else doing, or in alliance with other treatment regimes, especially with diabetes and other conditions, where you say, okay, I can take care of you on the podiatry side, but you might want to talk to a specialist that we have in Manila, and so you can make some of those great connections there. So as a podiatrist. Oh, and by the way, I didn't finish on the plantar fasciitis. How do I fix that?
So
I stand on the tennis ball, do the thing with that.
So tennis ball or a golf ball, rolling it around as you're sitting, not standing, because we don't want you to fall over and hit your head or something like that.
We get another
and
specialist
then you get another
for that. You go see the neurologist.
So,
We got you covered.
But certainly we have
literally.
We have an incredible rehab department, physical therapy department in-house, and they do outpatient physical therapy, and we're able to facilitate the healing of people in a very non-invasive manner.
There's another word for therapy. I'm trying to remember. They used it in the Middle Ages. Torture is what? No, I'm serious.
But it only makes you stronger.
All right, it makes you stronger. I've been through some therapies in the past, and I never mind. It doesn't hurt that bad, because they'll do things to you with heat, and the worst one, I didn't think it was going to be so bad. No, when they go in with the cold treatment, right? They'll go in with a cold pack and leave it on you for like a half hour, and that to me was more painful than anything else, than the primary malady that I was trying to cure. So tell me, we've got a few more gentle ways to do the therapy in the feet and the legs.
Well, certainly we use the mnemonic of RICE, R-I-C-E. So rest, ice. Certainly I would warn people about compression, not to do it, and let a healthcare provider put the compression on there.
Yeah.
And certainly elevating.
Yeah.
So R-I-C-E.
You brought up compression. and among runners and other athletes, they like to wear compression fittings on their legs and their forearms. And I've never really understood the purpose of it. For recovery, I can see it where it might be something where it helps push out the acids that you develop in the exercise. And that's just a function of what happens in the muscles when you're working out. So you might be able to use that and say, okay, this is how we're going to push it out of the muscles and bring you some kind of relief. But using compressions while you're actually exercising, while you're actually doing the running or whatever the workout is.
Yeah. So again, the pain that you're feeling from running is actually due to anaerobic respiration, and actually it's a buildup of lactic acid.
That's the acid
muscles.
I couldn't remember.
So,
we were talking about uric acid before, so that stuck in my head, but it was lactic acid. But that is the process, right, where the recovery compression will push it out of the muscles?
So it helps the veins. Remember, veins are what bring the blood back to the heart, and the arteries are what are bringing the blood from the heart to the rest of the body. And the arteries are what have the oxygenated blood, and the veins have the deoxygenated blood. And so sometimes when people don't have the best of veins or they have varicose veins, they require some kind of compression. And certainly with people who fly a lot, they should be wearing some type of compression sock, and this way to help prevent blood clots. And I think that would be something that you should speak to your healthcare provider, because
Well, I got one in front of me right now. I'm going to be on an airplane to Singapore next week, and I was a few weeks ago in Hong Kong, and before that I was in Manila. So I've been doing a lot of goofing off lately. It's show prep. It's research for the show. But so I should be wearing a compression while I'm flying?
Well, it's for high-risk patients mostly, and those who are not that mobile to begin with and are more prone to blood clots. Those are the ones that we definitely recommend either mobility within the airplane or a compression device, or just in-seat, just muscle tension.
I do the little exercises.
Yeah. But to go to your point with the tights and the compression, because when I run, I use it underneath my shorts, and it's a main benefit to the quads and the glutes, as well as it reduces shear force as well. So it reduces inflammation in that sense and makes you more efficient, makes your recovery better.
See, that's what I wanted. I want him to say, I'm going to make you faster.
Yeah.
So I'll definitely try out the compressions. I normally use them as almost as a means to prevent any additional pain from the longer run. So if you're doing a half marathon and a full marathon, I find that's usually my biggest problem as a runner. And I'll throw this out here for anybody that runs, because I think this is applicable for new runners in 5Ks and more experienced and advanced runners in half marathons and full marathons. It is often not a question of me bonking, from physical exertion or being tired from the run. It usually has everything to do with my feet hurt like hell at about mile 17 or mile 18, and it's really hard to get past that. And so, there was a time I'd run a couple of times with some painkillers to try to control it, and it helped. But I always felt like I was ripping myself off, taking something that everybody else isn't taking. So how would I mitigate the pain of running 17, 18, 22, 26 miles?
So I would begin with a great stretching regimen that would be prior to running, and you have to do it gradually. It's not something that you can do from day one. It may take 2 to 3 weeks to get your muscles maximally ready for that kind of run. So you can certainly, whatever gym you go to, you could see a trainer to evaluate you and to put you on a good program of stretching. Certainly by coming in, getting evaluated by your physicians for your overall health, and then certainly a recommendation to see a physical therapist for them to help you. Doing certain stretches are very important.
You'd mentioned that a couple of times, and I want to make sure that can I just walk in and see him, or do I? Because my primary doctor is Dr. Shea, which is unusual for a lot of people because he's a gynecologist. But he's when people ask, I say that it's.
Interesting, right?
Yeah, but he's my primary guy. So I need to see him before I can see Dr. Tutnauer?
You can see him.
I can just go see you.
I would certainly just check with your insurance companies and just evaluate if you need a referral to be seen.
Well, let me, because you bring up a point here that I think is there might be some listeners that are going, oh, we said insurance. I don't have that. It's really expensive, and so I've tried to cut that out of my life, or it's something that I don't have a job right now. With regards to that, are there ways that you've got, Rosie, that if somebody that might not have access to traditional insurance, where you might be able to find ways to help them through financing or connection with Medicare, Medicaid?
Yes, yeah. You know, we accept self-pay, and then of those patients are qualified to get into the program, the local programs of MIP and Medicaid, we actually facilitate and help them apply into that too.
Okay, so don't disqualify yourself. Nobody here wants you to live with pain, and if there's a way you can go to GRMC, see a specialist, and then we start talking about the numbers, the dollars and the cents of it, and there are people there that know their way around being able to find financing for this kind of thing to bring you some of the relief that you need. I'm really, really glad that you guys came here. I can hardly wait to see who you're going to bring in next, because it's always a fun conversation. The challenging issue, foot problems, what are among the most challenging for you, even as an experienced and seasoned doctor? The thing somebody walks in and presents and you go, oh God, not this again.
With 30 years of experience on the mainland, as well as with the Navajo Nation, I would certainly say diabetes is a major issue. And really what we've been able to institute is a diabetic preventative type of program at GRMC for patients to get reevaluated for their feet. I think that that's incredibly important. So prevention, what do they say? An ounce of prevention is worth a pound of cure. And certainly that's what we're trying to achieve with GRMC, with our multi-specialty type of system that we have in place. And so the most challenging, again, would be diabetics, as well as individuals who are like yourself, athletes or the weekend warriors. And we certainly have that available to us to assist them.
When he says weekend warriors, he means you guys that are 45 years old, haven't done a lick of exercise in the last 20 years, and all of a sudden your buddies say, hey, let's go play basketball.
Yes.
And
or go 5K.
Oh, yeah, let's run a 5K. Did I tell you what my brother did once? He lined up everybody in the office, and he says, we're going to run a 5K this weekend. And he hooked up with what the Guam Running Club refers to as the most beautiful run, which, wait a second, no, where's that start at? Because it's in the south. You start at Umatic, right? And then you go down the hill and you go to Maritzo. But it's not a 5K. It's a 5-miler.
Yeah.
Oh.
Yeah. I think there was a lot of salumpas that afternoon. There was used. Okay, so it's time for me to be an 11-year-old. What is the grossest puncture wound you've ever seen in 30 years? Just the craziest thing that you had to pull out of somebody's feet.
Well, certainly having foreign objects, people stepping on nails, people stepping on all kinds of splinters.
Too easy. Come on.
I got one.
Yeah, okay, go ahead, Felix. Go ahead, Doc.
Well, it was actually mostly a sad story. It was a diabetic who had severe peripheral neuropathy, so he couldn't really feel his feet. And this was in Connecticut, of all places, and it was a very hot summer day. He walked out into the driveway, onto the concrete, barefoot, was out there chatting with a neighbor, and came in and had severe burns on the surface of his feet. I mean, severe that he had severe infections that resulted from that and ended up in our ICU. And that was all just from hot concrete.
Wow.
And he couldn't feel it.
So again, a reason why if you can't feel anything, or if you're not feeling enough in your feet, remember what we said at the beginning of the conversation is that there's a ton of nerve endings down there. You should be able to feel the wind. You should be able to feel the gravity of the moon's pull and the changing of the tides with your sensitive feet. Okay, last question. Nail clippers. Good or bad?
So nail clippers, I think you have to be careful about the way. It's the technique, not just necessarily the nail clipper, but how you trim. I would always tell people, trim straight across. Do not cut into your corners. Leave it to a professional to cut into the corners. And we have different techniques that we utilize in order to remove those ingrown toenails. And certainly, with dealing with fungal toenails, there are medications, some of which are great topical medications that you can use for fungus toenails, and that you don't specifically have to use an oral antifungal or a pill. So we have topicals.
I was waiting for him to say, don't use nail clippers and have somebody chew them off for you.
So, Dr. Tutnauer is doing a great public service right now. He's voluntarily gone and gotten a pedicure, and he's surveying the pedicure places on the island just to assess their, to introduce himself, but also to assess their technique, right? And so, which is great.
Let's tell you what. Let me just 9:54. We got to take a real quick break. When we come back, and then you can tell me the story on that, and let me know for the ladies that are listening in the audience, and there's a huge number of them. Let me know what your findings are, and maybe we ought to leave the nail trimming at some of these foot massage places to somebody a little bit more professional. Be right back.
Yeah.
In this divided world, there are still a few things that unite us. The thrill of an exciting championship game.
Fires to the end zone. Touchdown!
The sound of great music.
The Grammy goes to...
And the love we have for that perfect burger. Ruby Tuesday Guam presents to you For the Love of Burgers menu. For a limited time, we want you to put down that fork, tuck that napkin in your collar, and go for broke with an amazing burger for just $11.99. 8 burgers to try, and time isn't wasting. Ruby Tuesday Guam lunchtime. See you soon.
Say hello to high-speed data on the widest 4G LTE network in the Marianas. We've just upped your prepaid data, so make your big plans bigger with 1 gigabyte of data per day. Bigger prepaid data for your big plans that just keep getting better. Enjoy high-speed data and unlimited local talk and text on the widest 4G LTE network in the Marianas. Text LTE to 3282, select a plan, and enjoy 1 gigabyte of data per day. Docomo Pacific, better together. Some conditions apply.
Feet's a fun interview. We can do feet every day because most people have them. If you have feet, I appreciate you listening to the program so we can talk about this. All right, so the last thing that we're going to touch on before we go is, and this is very common. I know guys that absolutely love doing this. Whether they, they'll go with their wives, they'll go with their daughters, and everybody goes and gets a pedicure, right? Like a manicure and a pedicure, and it's supposed to be like this relaxing, daddy and me, honey and me thing at the spa, and it sometimes involves cutting of the nails. And so you've been getting these pedicures around the island. Are there places that you think have no business touching your toenails?
Well, I certainly feel that if you're a diabetic, you should be coming in and being seen by your podiatrist because the key thing is, number one, the instrumentation, as you brought up before. The instruments should be sterilized. So we at GRMC use the highest level of disinfection and sterilization of instruments. So it's not just cleaning and washing the instrument. We're putting them through sterilizers, and we use 1 instrument per patient. So it's not like 1 instrument is being used on 10 different people. It gets sterilized, and so I think when you go to a spa, you should ask them, and you want to see their process of how they do it. We could show you at GRMC. We have a whole department. That's all they do.
Is clean instruments,
clean instruments and sterilize it. Yes. And so it's a much higher level of securing that instrumentation is absolutely unequivocally clean.
Yeah.
So
even something as simple as a pair of nail clippers that might have been used on somebody that's got a fungus now that is going to be attaching to your nails and maybe getting into your tissues and causing you all kinds of problems. That's a very good point. Should I do that at home? I got nail clippers at home. Should I stick them in boiling water every once in a while?
Well, I would say minimally you should be cleaning it with alcohol.
Yeah.
But again, I would leave that to the sterilization people to really answer that.
Yeah, I reserve alcohol for happy hour. We got to bring him back because I'm realizing there's so much more left in the conversation I haven't talked about. What is an actual bunion? How do you get them? How do you get rid of them? There's all kinds of other diseases. I'm trying to remember the name of a TV show I was watching where the guy, it was like an eczema or something, and he had it real bad on his feet and his neck and places like that.
He was a reporter.
No, the guy was a lawyer. It was on Netflix. The show I'm talking about, and a great deal of pain and embarrassment, and all kinds of home remedies. The guys on Facebook Live were talking about some home remedies, Clorox the feet or something like that back in the old. But there's so many new things and wonder medicines and wonder drugs that you can take now that will help solve these problems. So that it's not like you're walking around with cabbage on your feet.
So first of all, I would tell people not to soak their feet in Clorox, and again, not to use anything that could be potentially caustic to the skin. So that would be, one of my most important messages to get out there.
Well, we'll lean on some other important messages. In the meantime, be kind to your feet. You generally only get 2 of them in a lifetime, and you don't want to lose them for any reason. And diabetes is a terrible disease. In most cases, it's preventable. See your doctor today so that you don't have to see this doctor tomorrow. The radio station is KUSG Hagåtña. They're your health partners at Guam Regional Medical City, and I've had a great time with this interview. And but it's time for us to go. Dr. Felix. The night of
HBO series.
I think that's the night of. You're absolutely right.
It was the detective.
Rosie, always good seeing you.
Yes,
Well,
yeah.
see
Come
you-
on.
see all the
Call
kids
us
stuff.
for appointment anytime.
Medicare, TRICARE, all of the usual cares that you
Uh-huh.
need to help pay for some of the bills. And, of course, they take insurance. We're KUSG Hagåtña, The Point, where we're headquarters for Fox News. See you tomorrow.
For a compromise plan. I'm Lisa Lacera, Fox News. President Trump gives the okay to a Republican immigration bill that ends the policy of separating families who cross the border illegally.
In an evening meeting with House Republicans, President Trump endorsed a consensus measure to bridge divides between moderates and conservatives.